Well, hi everyone. I'm Branden Bonifer, and you are on Focus. And today we're sitting down with Chief of the Fire Department in Marshfield here, Scott Owen. Scott, how are you doing today?
Doing pretty good. How are you doing, Brandon?
Doing very well. A lot of developments have taken place here in central Wisconsin and throughout the state over the last couple weeks, and it seems like every few days we get a little bit more information. Being with the fire department, obviously, I imagine a lot of the information is coming down to you guys as well. In your preparation, what are some of the things you guys are discussing, if it be amongst your senior leadership or your staff?
So we've been doing a lot of preparation with the COVID-19, or more commonly referred to as the coronavirus, uh, just in our day-to-day operations, things that we're going to do, things that we're not going to do as a result of this. Um, we've just been doing daily briefings with the shifts, letting them know where we're sitting, what's all happening, answering their questions because some of them do have some concerns, and rightfully so.
Have you seen a change in calls or people calling and asking questions, but maybe they have some of the illnesses or symptoms we saw today? Marathon County Sheriff's Department put out a post about a number of 911 calls coming in. Are we experiencing anything like that here in Marshfield?
Not that I'm aware of. I just got off a meeting with the police chief and others in the city, and nothing was mentioned about that. It is definitely a change, though. You know, our call volume, I wouldn't say that it has increased. We are seeing a couple of calls with flu-like symptoms, but nothing too bad right now. Our biggest change right now is we've seen a dramatic decrease in the amount of interfacility transfers that we're doing from Marshfield to other hospitals like Madison, Milwaukee, Mayo, whatever it is. We've seen a decrease in that, and we're attributing it to all the hospitals are full and busy right now. And so we're actually taking this time that we're not doing the transfers and doing extra station cleaning, doing disinfecting of all the ambulances, the fire engines, the trucks, everything. Trying to get in some training that's needed, and um, it's been different.
Yeah, and you talk about different. One thing that you've done a really good job, you have now for a couple years, is really just being transparent and communicating. Over the last couple weeks, you've had a number of posts on social media, and a couple of those have gained a lot of attention for you,
Mhm.
especially one that you kind of did a week or so ago regarding your situation with PPE and how the EMTs or the paramedics might be responding to a call.
Right. Yeah. Thursday, I think it was Thursday, one of my shift commanders had come in and talked to me about a situation that they encountered. One of their ambulance crews had gone on a call, and we have Wood County Dispatch asking specific questions of people calling into 911, such as, do you have a fever? Are you coughing? Have you been out of the state lately? Anything like that. And any yes to those questions, we get dispatched as a positive response. And that positive response doesn't mean that they are COVID-19 positive. It just means that they responded positively to those questions. And we're going to take the extra precautions just really to protect ourselves as well as the patient. The crew went on this ambulance call to a positive response, and they came out of the ambulance in their full PPE, their mask, their gloves, the gowns, eye protection, everything. And neighbors were a little freaked out by it right away, thinking that the neighbor has the coronavirus and all of this, and not the case at all. It's all precaution, as Deputy Chief Steve Bacus says, we are being hyper vigilant in our PPE to protect everyone from this. So the big thing is, if residents see this, see us out and about, and we do have all of this gear on, it's for everyone's protection, and that was one of the main points that I wanted to drive home on that message on Friday, to try and put some people's fears at ease.
Yeah, and you mentioned a very important piece that this is really for everyone's protection, not only the protection of the potential patients, but even protection for your own staff. And in regards to protection for the crew that you serve for, how are you guys doing on supplies and that protective equipment?
Right now, we're doing okay. We actually have gotten quite a few donations from local businesses with nitrile gloves, which is awesome. Gloves, we're doing okay on. Masks, we're not doing too bad on right now. Gowns, the crews are using more gowns right now than I think I've seen in a long time. So the gowns are going to become an issue here probably in the next week or two. But overall, the PPE supply is doing okay. The strategic national stockpile is supposed to be uh, getting us some supplies. Um, we're waiting to hear when those are coming in for us. Um, but other than that, we seem to be doing okay. We continue to get our supplies as we need, and we help out where we can with supplies for others if it comes to that.
And you mentioned before you got on the call with me for this podcast that you've had the opportunity to talk with other officials in the city, as well as you mentioned the police chief. We saw a video here a couple days ago where the city really could have really stood together as a unit and really talked about your guys' preparation. That
Mhm.
was hosted at the fire department, so I have to believe that you guys have all been closely connected over the last few weeks, almost talking daily. Or how frequently are you guys as a city communicating between yourselves, different public safety individuals, the county, and the clinic here?
So we do talk fairly regular. I would say not every day, at least 2 or 3 times a week. It kind of depends. Last week when we did that joint video, we um, had a meeting prior to that, and our meetings right now are consisting of the oh boy, who's all in the Marshfield Clinic, obviously City of Marshfield. So myself, Rick, the police chief, city administrator, um, the mayor, our communications guy, um, Deputy Chief Bakos on the EMS side of the house. He sits in United Way, YMCA, Faith Community, the school district, both public and private. Mackey. So we're trying to bring everybody together and come up with one message that we can get out and ensure the residents that everything we're doing in preparation and response to this is in the best interests of everyone. Um, so, like I said, we meet 2 or 3 times a week. And it was kind of interesting or kind of funny at that press conference, the taping. We had talked about, do we maintain our 6 foot social distance? Um, if we maintain our 6 feet between individuals, that's going to show that we're practicing it. Um, but if we come closer together, it shows that we're one unit working together. In the end, we decided to go closer, and it's kind of funny because on Facebook, there have been a couple of posts of, well, practice social distancing, and we are. Um, it was just for that particular thing we didn't, and hindsight is 2020, and maybe we should have just done the 6 foot, but um, it's all good. We're doing our meetings. Most of our meetings now are teleconference. So the one we just got off of today, we used a teleconferencing platform, and again, hitting up all of those entities that I mentioned before.
Well, and this is so new for everybody, not only just you, but also for people in my business, people that have other businesses in the community, and like even church groups. I mean, we're all kind of trying to embrace this social distancing. And when you guys first did that video, and you're to give you guys full credit. I mean, at that point, we weren't at a spot where they were really encouraging, the 6 feet apart. They were talking, okay, groups smaller than 10. That's what we want to see. And I think, even in my reporting last week, I went out and met with a lot of businesses and a lot of individuals and tried to get firsthand knowledge of what they were doing. In hindsight, looking back, we weren't practicing the best social distancing, but between every interview and between what we were doing, we were, sanitizing and disinfecting ourselves and making sure we were sanitizing our gear. But this COVID-19 seems to be on everybody's radar, and it seems like it's occupying a lot of our time and energy. But business still goes on, and there's a lot of good things that been in the works here at the fire department. Obviously, you guys have scaled back access to the station, but in the last few weeks, you got a new pickup truck that you've been able to decal and give some presents to. You got this new, I don't want to call it a toy, but a remote apparatus that you guys can use for education.
Yep.
And there's, that is just one of a number of things that you guys have been doing. So let's kind of back up a little bit. And those are all part of your daily plans on top of this COVID-19 thing. So the truck itself, I think it's called truck C5, correct? Did that replace a unit? Is that a new unit?
That replaced, oh boy, what is old car 5 was a 2007, 2005, something like that, that had 170,000 miles on it.
And is that vehicle used for mostly doing preventative checks, business visits, and stuff like that, or is it really used for dispatch needs in the event of a call?
So it's actually a twofold. Old car 5 was more of a support vehicle. If we went out of town to meetings or conferences, that is the one that went because it didn't have lights or radio or anything. The new one is going to be the primary vehicle that our fire inspectors are going to use. So they'll be out in that vehicle during the day doing their fire inspections, and they'll be responding to calls in that vehicle during the daytime period.
Now you talked about fire inspections there, and I believe, correct me if I'm wrong, but um, you guys have postponed doing fire inspections in the city of Marshfield at the moment, correct?
Correct. Yes, we suspended doing all public education events, all station tours, and we have suspended routine fire inspections. We're going to reevaluate it probably mid-April, see where we're sitting. But my guess is we'll probably go through the end of April on that.
And
Uh,
some big, and I've been through a number of these inspections, and I think it's just healthy to sometimes allow, especially as we are self-policing or staying in shelter. Obviously, we want to make sure that we keep extension cords to a minimum, make sure it's still that time of the year where a lot of people have heaters in their office or in their bedrooms, make sure those aren't plugged into power strips, and check the dates on when those fire extinguishers expire. What other things might you encourage people should just kind of self check, just to make sure that we kind of keep that good preventative care and maintenance in place?
Yeah, like you said, making sure that we're not using power cords and extension cords, making sure that, especially in the apartment complexes, that smoke detector batteries have been changed, that the smoke detectors in the common areas are working in businesses, detectors and exit lights. The biggest area that we really need to emphasize is making sure that egress points from the building, so back doors, front doors, whatever, um, remain clear of stock or garbage or anything like that. Anything that would um, decrease the chance of a quick exit, those just need to be maintained clear. And we will go out and do a life safety inspection, as we call it, if we get a complaint or a concern. So we will go out and do that. Deputy Chief Pete Freddie, who's in charge of prevention, will be doing all of those special inspections right now. Um, but for the most part, yeah, the routine ones have been temporarily suspended. We're working with businesses to try and um, clear up some of the violations they may have. But other than that, it's we haven't heard much from businesses, which is fine. That's good. We don't want to impose on them right now in this time, much less expose everyone to potentials.
So we talk about businesses a little bit here and imposing on their time. One other thing that kind of comes to mind, obviously, with several businesses throughout our community that are going to be kind of going into, call it, shutdown or limited access. We've seen a lot of, especially the restaurants, they don't have cars in their parking lot. We're
Mhm.
kind of still in that season where it may snow. And if it does snow, obviously, and there isn't a fire or some type of emergency, you guys still need to have access to it. We've seen in the past where businesses that are maybe closed or buildings that are abandoned, they do kind of what we would call an emergency plow. What do you recommend that businesses do in the event that there's a snowstorm or something like that, but they don't really want to service their parking lot to the traditional means that they used to?
Well, they really do need to keep access points open for us to get in the event of an emergency. I know there have been in the past some instances where a building has gone up for sale, it's vacant, and the owner of the building called us and said, "Yeah, I'm not going to maintain the driveway or whatever." And we basically ask them or tell them, please maintain it. We need to have access. If it's a delay for us, it's a delay in getting that fire put out. And business owners are very good about it. We explain our reasoning, and they're very good. So just trying to keep that access path open is important.
Well, Scott, thank you for that all information. And just kind of jumping ahead and trying to share some excitement here. You guys got I've seen a couple of videos. If you guys are out there listening, we'll have it in the link in the description to jump over and follow the Marshfield Fire and Rescue Department's Facebook page. I think you guys are almost at like 3,500 or maybe even close to 4,000 followers now. And like I said in the beginning of the broadcast here, you guys put out a lot of information. You've been definitely transparent. But if you are at home and you're a parent and you kind of want to showcase something to the children here in the area, there is a cute little video, and I'm going to use the word cute because it is pretty cute. Freddie the fire truck has arrived in Marshfield, and I guess I first will understand that this was a collaborative project of several different business and individual donors coming forward. Let's talk about that, and then let's talk about what is this call it apparatus? What is Freddie going to be used for in a department? And I understand it's kind of principle for education needs.
Yeah, it is. And you were talking about our followers on Facebook. Just looking at it right now, we're up to 4,800, which is awesome. That number has really jumped this past 2 weeks or so. But yeah, Freddie the fire truck has arrived. Freddie is an educational robot that we're going to use at various events in school. We are going to use at community events. Once this whole coronavirus issue is done, Freddie will be out and about. We are going to hopefully take him to the Dairy Fest parade. We're hoping to take him to the mayor's breakfast, Central Wisconsin State Fair, Hub City Days, all of these things. We had planned on going to Children's Fest on April 18th, but unfortunately that was canceled. So Freddie is sitting under wraps right now, but I'm actually going to talk with uh, the firefighter who's in charge of Freddie, his handler, if you will, and we're gonna try and put out maybe some.
How did you apply for? How did he apply, or did she apply for that job as handler, Freddie?
Yeah, he said I'd like to purchase this, and we'll talk about that in a second. But if you ask to get something, it's kind of your baby. So um,
And all the work that goes with it, right?
yeah, so we are going to try and do a little pub ed on Facebook with him. I'm hoping to be able to, read a story or something, or have the kids be entertained by, Freddie telling them to wash their hands and all of this other stuff. So uh, the handler is on tomorrow. I'm hoping that we'll get something posted tomorrow, but. Uh, Freddie is Freddie is, like you said, a collaboration from different businesses. He was purchased with donation. No tax dollars were used at all. And We have a wide variety, excuse me, of businesses and individuals in the community that donated to him, and we're actually hoping that we'll be able to get Andy the ambulance in the future as well. That'd be Freddie's companion, and use Andy as well for different health events, and again, more public education.
And you mentioned some of those supporters on your Facebook page:
Yeah.
Enbridge, McDonald's, Marshall Clinic Health System Foundation, the Walmart here in Marshfield,
Yep.
Provision Partners, Land O'Lakes, Cheese Operations. I believe that must be the one out of Spencer, and
Yep.
then um, Simplicity Credit Union. And then I believe there was two additional individuals.
Hmm. Yeah, Dan Jonas is one of our retired firefighters. He came in, he saw the project and wanted to make a donation. And then Joanne Oppman is also a retired city worker. She was our ambulance account specialist for a long time, and she made a donation to Freddie. So we're very thankful for everyone that donated, and um, Freddie's going to be a great addition to the public education for the kids of this community.
And if you guys want to see Freddie, go ahead, hit that description, check out the link, jump over to Facebook page, and I guess you know what, maybe Freddie needs his own Facebook page, or we've seen a lot of Instagram pages that have been dedicated to cats or animals. Maybe Freddie has its own page there someday.
Yeah,
Um,
maybe.
but the news continues. Obviously, there's been
Yeah.
so much going on, and it's one thing I kind of we've been trying to do this is trying to decompress this COVID-19 and all the discussions that have been taking place with that. But throughout the community, there's been lots of other great things that are happening, and no different than the fire department. We've already covered a number of them. One item that kind of came up on my radar, and I don't want to say it got lost in the news, but it definitely hasn't gotten maybe the publicity that is credited to it. But you guys got a pretty strategic role to play a partner in a shoot with Discover Wisconsin, the Marshall Clinic, and Sam Voigt, who has been an athletic trainer here in a while, really was part of that part of that story, and part of the story was filmed at the fire station itself. Kind of tell me a little bit about that and what the role was with the fire department being involved in that story, Discover Wisconsin, the clinic, and Sam Voigt.
Yeah, so we work closely with Marshfield Clinic Health System Sports Medicine every year for especially the football program. And I was contacted by Sam Voigt to see if we were interested in helping them out in this venture, and definitely, jump at the chance to help them out. They provide us some great training, and we interact with them on a regular basis at the football fields. Um, but they had said Discover Wisconsin was coming in to do a segment on sports medicine and the Marshall Clinic athletic trainers, the student trainers at the schools and at the clinic itself. It was a natural tie-in for us, being the transport service for Marshfield and um, Auburndale and other area high schools. It was a good fit for us. Um, our crew had a limited role. The primary education and explaining of everything was done by clinic trainers, but our crew did lifting of the patient, move them into the ambulance, do that type of simulation, and it was good exposure for our department, and we were very happy to do it to help out Sam and Dr. Rudolph and the other trainers that were here that day.
And will that be part of an episode? Will that air on Discover Wisconsin, or is that going to be something that's only really distributed through social media and in the news groups?
I believe it's going to air on TV, but I don't know 100% sure, or I'm not 100% sure on that.
Okay, and then two things before we go yet. Obviously,
Yeah.
with the change in times here, obviously you guys always do a campaign around the clock season to make sure to tell people when the clocks change the batteries in your guys' fire extinguisher, or not fire extinguishers, but it's good to check them at that time too.
Yes.
But to change your batteries in your smoke detectors. In the past, you guys have offered some programs for smoke detector alarms. Is
Mhm.
that something that's still going on, or what is it that the department's doing with smoke detectors this time of the year?
Yeah, so we're still part of the smoke detector program through the Red Cross. Earlier this year, we went partnered up with Red Cross volunteers and installed, I believe, it was like 60 smoke detectors in 30 residences on a Saturday. We still have smoke detectors available. There's certain criteria that needs to be met, and that information I don't have off the top of my head, but they can always call and talk to Deputy Chief Pete Freddie. He's the one who oversees that. But with the COVID-19 right now, that program is suspended as well, just because we don't want to take those unnecessary risks out there for the clients or for us. But as soon as all of this is done, we'll be resuming all of those programs, and it's a great program. It's a great chance to get out there and put in detectors that we know are working, as well as educate the residents on changing the batteries, doing testing, practicing your escape plans, what to do in case of a fire, where do you go, all of that good stuff.
Absolutely. And then as we move past this, that'll definitely be a conversation. And for those that want to know more about it, we've covered it a number of times. Hit the search button, and I'm sure if you type in Marshfield Fire Department smoke detectors, you'll get a. I think we've done now 2 or 3 articles each year that have kind of supported that program. It's been almost a month, and we hope by now the police department has licked all their wounds and they put their badge back on their chest. But you guys did some major PD whooping at the Cabin Fever Festival. Have you guys had a chance to display your trophy that you it's received after? I think you guys beat them, but like I don't even think they finished the
Yeah,
obstacle.
we were actually coming back from a Chiefs conference, and so I wasn't even there. Unfortunately, it sounded like the PD they had an incident they were dealing with, and so they couldn't get on duty staff there. But the chief and the two ordnance officers did their best, but in the end, our firefighters were quicker, and yeah, we did beat the PD. So that's one time that we beat them. We don't beat them real often in things, but um,
Well, if anybody's watching, I just think that for Officer Larson's sake, he definitely takes some practice at the bagel tournaments this summer, and hopefully sharpen his skills a little bit.
yeah,
Um,
we're still waiting for the trophy. It was out being engraved. So as soon as that's done and here, it'll be up on the Facebook.
Well, I almost have to wonder though if it's taking a little bit longer with just giving that PD department a little opportunity there to kind of move past. Watching the video though, it is definitely entertaining. I mean, it's cool that in a community the size of ours that we have so much access to our firefighters, our EMTs, our paramedics, and our public safety officers, if it be our ordnance officers or the police department. It's just you guys really do make yourself available if it's in the classroom, if it's in the community. You don't see that in other communities that I've paid attention to, like you do here in Marshfield, and I think that really kind of it helps everyone kind of move through times. I think we're all think of ourselves as one big community, and I think that's it's important when we have these type of community events that we're able to showcase that. Obviously, we've taken up a lot of your time. For those that are still listening, I mean, this is something different, something new. Obviously, with COVID-19, we're still trying to make sure that we feel connected. And, for those that are either sitting at home or, just kind of in some solidarity at the moment, this is a good way for us to try to connect and communicate with you guys. What else is going on, Scott? Anything else we should cover in this episode?
Um, Boy, there's just so much right now. We have so many meetings and planning sessions over COVID-19. My life has gone from doing my normal day to day fire department duties to doing my normal duties plus dealing with all of the COVID-19. And I do want to say though, our department members have embraced this. They have stepped up. The station has never looked as clean lately as as it has. They're busy cleaning, disinfecting everything. All of the deputy chiefs have really stepped up, especially when it comes to writing policy or procedures for this, trying to get ahead of it and keep everyone safe. And um, Deputy Chief Steve Bacus in charge of EMS, uh, he's been doing research nonstop, trying to make sure that we're ahead of the curve and ordering supplies and all that good stuff. And of course, Wood County Health. Um, I feel bad. Uh, I email Sue Comferman, who's the director of Wood County Health, quite a few times a week. And in my subject line, I always start, "I'm really sorry and I hate to bother you, but."
You know what? Don't feel alone, because that's exactly how I start the emails, and
Yeah,
it's usually, but I have to admit, the county is doing a stand-up job. I mean, I emailed them, I think, on a Sunday night at like 8:30 at night, and it wasn't by 9:15 that Susan, I think even Christy down there,
yep,
gave us a reply. And I think, for those that are at home and they say, oh, there's so much news, there's so much information being sent out there. It's really because there's so many of us that are asking for it, and these departments and these health officials, I mean, they got to be at their wits' end trying to collaborate all the data and then being able to connect with all of us. So, I mean, you got to give them kudos, like you were saying, and kind of starting with that. They're really trying to streamline the information so that everyone can react to it the best they can and use that information to make their next move. Because literally, we're making moves every day.
yeah. And the only other thing with the COVID-19 that listeners really need to understand is in the next, week or 2 weeks, you're probably going to see a spike in the number of cases that are
Absolutely.
positive. It's only because we're doing more testing. The testing sites are able to take more and more tests now, so the results are going to come in a lot faster. And people shouldn't panic because the numbers are rising that fast. Just understand that more testing is being processed, and we're able to get a better handle on current conditions.
Absolutely. Well, Scott, I just want to thank you for your time. It's been a pleasure. It's been over 30 minutes now, which we've covered a lot. And, I think this call and this podcast really started out just really as an informational brief, but we got to uncover a lot of things with what was taking place at the fire department. Obviously, your victory over the PD, the expansion in your two new apparatuses, one being C5, the truck, the second being Freddie, the fire truck, and just talking about general health in the station.
Yeah,
As we continue to communicate what's taking place in our Marshfield area, guys, in addition to the link to the fire department's Facebook page, which we encourage you guys to jump out there and follow them. Like Chief Owen said, they've had a lot of new followers and they're putting out a lot of good information. So if you're not a follower of theirs, now's the time to do so. But there's also a dedicated page. We've made a point to have a landing page for everything in the community, if it be restaurants that are doing takeout and curbside pickup, to businesses that have adjusted their hours or doing home delivered services, to cancellations, worship information. We've created one landing page with it all. It got the school updates for local schools in the area, as well as information regarding what's taking place in our health professional fields. So bookmark that page. Not everything we do goes on social media. A lot of stuff that we're doing, especially in the business update category, is going in that section. We're trying to put as much information out there. So if you have it, and more importantly, if you're a business and you don't have the communication platform that some of us do, we're trying to give you the opportunity to utilize it the best we can. Scott, thank you on behalf of my staff and the community. Share with your staff. We appreciate everything you're doing. We obviously don't get to see face to face or get into the station like we did, but we know that you guys are hard at work doing what you're doing.
that we are. We appreciate you doing this podcast, and eventually we'll get back to somewhat normal, and um, we'll be able to do face to face meetings again. But yeah, just have everyone stay tuned to our Facebook page, our city website. We try to maintain it. Facebook is the fastest way for us, and we'll keep everyone as informed as we possibly can.
Sounds good, Scott. You guys have a great day. For those that are tuning in, thank you. And if you haven't already, follow us, follow our page, and we'll see you in the next episode of On Focus. I'm Branden Bonifer. Have a good day.